Hello and welcome to Former Pro Mastery Hub. Today on Know Your Medication, we'll be looking at the drug Celecoxib. Celecoxib is a non-steroidal anti-inflammatory drug classified as a selective cyclooxygenase 2 inhibitor. It is widely used for its anti-inflammatory, analgesic, antipyretic properties with a potentially lower risk of gastrointestinal side effects compared to non-selective NSAIDs. Celecoxib's mechanism of action involves selective inhibition of cyclooxygenase 2 enzyme. COX-2 is an inducible enzyme that plays a key role in the synthesis of prostaglandins responsible for pain, inflammation, and fever. By specifically blocking COX-2, Celecoxib reduces prostaglandin production at inflamed sites, thereby elevating pain and inflammation. Unlike non-selective NSAIDs, it spares COX-1, which help protect the gastric mucosa and maintain normal renal blood flow, potentially decreasing gastrointestinal side effects. Indications for Celecoxib is used in the management of osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, acute pain, primary dysmenorrhea, familial adenomatous polyposis, that's FAP, that's for polyps reduction, that's for off-label use. Dosage advice for osteoarthritis and rheumatoid arthritis. Typical dosing is 200 mg once daily or 100 mg twice daily. Dose adjustments are necessary for hepatic or renal impairment, and duration should be as short as clinically feasible. Remember, for dosage, the pharmacist will tell you what dosage to take based on the severity of your condition or whatever is wrong with you. Remember, do not self-medicate. Common side effects include dyspepsia, diarrhea, and headache. Serious risks involve cardiovascular thrombotic events, gastrointestinal bleeding, hypersensitivity reaction, and renal impairment, especially with long-term use. Remember, you don't use NSAID for a very long time. Important note to healthcare professionals: it is not recommended for patients with history of cardiovascular thrombotic events. The Celecoxib should be used at the lowest effective dose for the shortest duration possible. Regular monitoring of blood pressure, renal function, and size of gastrointestinal bleeding is advised. So, patient counseling tips: you ensure you advise the patient to take the drug with food to minimize gastrointestinal upset. You encourage the patient to report any signs of unusual bleeding, chest pain, or severe adverse reaction. You also encourage the patient to be aware of cardiovascular symptoms, and then encourage the patient to inform you as a pharmacist about all concurrent medications in order to avoid taking overdose or taking similar products. If you found this video helpful, give this video a thumbs up and share with your pharmacy circle. Subscribe for more clinical gems right here on Former Pro Mastery Hub, where pharmacy meets mastery. Thank you for staying till this time. See you in the next video.